So this is the second part of the elimination urinary and GU assessment for Nurs 100, and we just finished reviewing nursing actions to promote urinary elimination. Risks associated with catheterization include urinary tract infections, blockage, and trauma. It's important never to force a catheter. There are different types of catheters: intermittent catheters, indwelling, and third lumen. Third lumen are used with the installation of medication, such as with a bladder irrigation, and the final is coude cath, which is used for males with enlarged prostates. It's important for nurses to use strict aseptic technique, and a doctor's order is needed. We will demonstrate this in lab. With catheters, they have a different French size, which refers to the size of the catheter itself. Children is 8 to 10, women is 14 to 16, and men is 16 to 18. It's most important to use the smallest catheter. Be aware of any latex allergies the patient may have. And silicone catheters can last up to 2 to 3 months. The balloon size most common with catheters is 5 milliliters, and they inflate with sterile water. Indwelling catheters are hooked to a closed drainage bag and hang on bed. They should not go on the rail or on the floor. And they should be used for the least amount of time possible. As soon as possible, discontinue them. Catheter care. It's important to keep the system closed. Empty the drainage bag as needed. Always keep the drainage bag below the level of the bladder to prevent urinary reflux. Keep the spigot of the urinary bag closed. Again, do not allow it to hang on the floor. Keep it free from kinks. And also provide routine catheter care every shift with soap and water and rinse. This is typically most policies identify that catheter care should be 3 times a day. With fluid, it's important to increase this with a patient who has a catheter. It does help to prevent infection. So the next slide we're going to look at is measuring urinary output. It is a part of the assessment, even if it's not ordered, and it's the responsibility of the nurse to keep accurate recording. Urinary output is key to identification of proper kidney functioning, and it's important to be aware of that anything less than 30 cc's an hour for over 2 hours, you need to notify the doctor. Bladder irrigations needed physician order. It's important to keep the irrigation line free from blockage, keep the system closed, and with open irrigation, they are not as common but can be used to install medications. Alternatives to Foley catheters include suprapubic catheter, which is surgically placed, and it's often used long-term for patients who need their kidneys protected but will require long-term catheter use. And also the condom catheter, which can be used in incontinent comatose men. It's secured with tape, has a rubber self-adhesive. It's important not to put that on too tight. And with condom catheters, there's little risk for infection. The condom catheter is suitable for incontinent or comatose men who still have complete and spontaneous bladder emptying. The condom catheter is a soft, pliable latex sheath that slips over the penis. Patients wear it only at night or continuously, depending on their needs. The nursing staff do need to monitor for skin breakdown. You also need to ensure that the skin of the penile shaft is intact and free from swelling, redness, or open lesions before applying the condom catheter. The physical assessment for elimination is what we're going to review now. With general survey, you'll start with general questions. Have the patient report any discomfort. Let them know that you will be touching them and ask permission. Put the patient in a supine position with abdominal area exposed. And then you're going to check for color, appearance of hydration, scales, masses, or scars. Patients with kidney disease often look tired and complain of fatigue. Elevated nitrogen waste levels lead to mental confusion. If there is suspected kidney disease, look for signs and symptoms of circulatory overload such as periedema and scratching. With the focused interview, you'll ask specific questions. You'll ask about illness or infections, any symptoms they may be having, complaints of pain, behaviors that they have, such as frequent toileting to prevent incontinence accidents, if they're using pads for urinary incontinence, what types of catheters, if they're providing intermittent catheterizations to themselves. With infants and children, you'll ask about potty training program or any unusual shapes or structures that have been noted by the parents. Pregnant females, ask about changes in any patterns, urinary patterns. In older adults, you also want to include questions related to the urine stream or effort to urinate, and this is especially true in men. And environmentally, you're looking to see, do they have an access to the bathroom? Equipment for the examination, you'll want an examination gown and drape, gloves, stethoscope, and a specimen container. With inspection, you're looking for color, contour, symmetry, and distension by standing at the foot of the bed. A distended bladder may be visible in the suprapubic area, as you can see on the picture here on the right. Typically, the abdomen is not descended, it's distended. It's symmetrical and free of bruises and masses, and that is the example on the left. To auscultate, you will take your stethoscope and listen over the extended midclavicular line on either side of the abdominal aorta and listen for renal bruit. Usually there's no sound auscultated. However, thin adults, the renal artery pulsation may be auscultated. You will palpate the costovertebral angle and also over the symphysis pubis for the bladder. No deep palpation. Have the patient face away from you with back exposed to palpate the costovertebral angle. Inspect the left and right costovertebral angle for color and symmetry. Look for any protrusions or that might identify a gross enlargement. If the patient does complain of pain in the pelvic region, don't percuss or palpate. And finally, if the costovertebral angle is tender, if there's red, warmth, and the patient has nausea, vomiting, it's signs and symptoms that the kidney could be infected. Abnormal findings in the urinary system are bladder cancer, kidney and urinary tract infections, renal calculi, renal tumors, renal failure, and changes in urinary elimination. So this concludes the lecture on elimination and urinary assessment. Thank you.